We are 4 years into the pandemic, and by now, most people have had COVID at least once. But when the virus comes for us again, it can still feel just as alarming as your first bout. Let's take the details. This is Krishnendu Nair. The most common COVID symptoms haven't changed much since the start of the pandemic, and they remain consistent for the latest dominant variant JN1, which includes fatigue, sore throat, congestion, runny nose, headache, body aches and cough. Some people may develop conjunctivitis, also known as pink eye, or experience gastrointestinal issues like nausea, vomiting, diarrhea, but those symptoms are rarer. Anecdotally, experts said one of the most notable symptoms early in the pandemic, the loss of taste and smell, also appears to be less common these days. As per reports, the biggest change now is that people are having milder symptoms overall, and that's because virtually everyone has some pre-existing immunity from vaccines, a prior infection, or both. While COVID is mild for most people, it can be dangerous and even fatal for some. Data from the Center for Disease Control and Prevention indicated that as of mid-February, is that more than 21,000 people are hospitalized with COVID, and there had been roughly 10,000 COVID-related deaths in 2024. Let's check the isolation rules. The CDC said that Americans with COVID or other respiratory infections need not isolate for 5 days before returning to work or school, in a striking sign of changing attitudes towards the coronavirus. Next is the long COVID scenario. A large new study has found that long COVID may lead to measurable cognitive decline, especially in the ability to remember, reason and plan. Next is spring shots. Americans aged 65 and older should receive an additional dose of the latest COVID vaccine this spring, the Centers for Disease Control and Prevention said. Overlooked clues. Newly released documents indicate that a US genetic database had received the genetic sequence of the coronavirus 2 weeks before it was made public by others. Severe illness is a lot less prevalent now than during the first few years of the pandemic, but we are still seeing it. The people who are getting sick tend to be those with compromised immune system and underlying health conditions such as heart disease, diabetes or lung problems. Adults over the age of 65 are also at a higher risk for severe infections. Since mild COVID can look like a cold or the flu, it's important to test yourself if you have symptoms or have had a known exposure. Knowing what you have can affect your treatment and how long you isolate from others. On March 1, the CDC updated its guidance for preventing the spread of COVID and other respiratory viruses. The agency recommended that the people should isolate until their symptoms have started to improve and they have been fever-free for at least 24 hours. The agency acknowledged that people may still be contagious at this point and should continue to take precautions like masking and physical distancing for the next 5 days. The antiviral pill Paxlovid is very effective against severe COVID, reducing the risk of death by 73% if taken within the first 5 days of an infection, according to a preliminary study conducted by the National Institutes of Health. Experts urge that people who are with high risk to contact their doctors about getting a prescription as soon as they have symptoms or test positive. With the acute phases of the COVID pandemic fading even as the coronavirus persists and evolves, a new normal is taking shape around the world, it seems.